This conference will now be recorded.
Good morning. Part 1 examination. Part 1 is very important part out of you, and because it's very hard to find a place, get the exam, and then, as you know, it can be quite challenging that if you pass this exam in your first attempt, because after that you should go on to the next level. So this is just the basic exam. So the most of the candidates send me messages. They want to know that what is this exam about, why it is important. So what should be done, who can take it, and how we can pass it. That's why I divided facts into these parts. So basically, this exam tests the knowledge base of the basic sciences as they pertain to OB/GYN. Single best answers, that type of question is used to assess you. So doctors taking the exam should know that what exactly they should read. So basically, you are supposed to read all basic subjects. From where do you want to read it? It depends upon your own convenience. If you have time, then you should go for Essential Revision Guide. If you don't want to read that, then there are many other wonderful resources. Basic concept is that you should revise your basic knowledge of anatomy, physiology, biochemistry, pathology, microbiology. Microbiology further covers general bacteriology, general microbiology, and specific one. In specific, you should know about virology, about bacteriology, about immunology, parasitology. These things should be very clear. Then you should know a lot about the pharmacology. Many questions are tested here, like what are the different groups of drugs, what are their modes of action, drug interactions, all of these things. We are going to talk about them in a bit. Then embryology. In anatomy, you should know about the histology of structures, about the anatomy, about embryology, and you should also know about applied anatomy. That's very important for you because, as when you're training for the part two, you have to do many surgical procedures. So you should know what exactly you are doing, where you should give incision. So if you don't know about the landmarks, then you can have a problem. That is the point. Okay. So then going to the other disciplines, there is biochemistry. So basically, you should know about the main mechanisms and stuff. Metabolism is very important. What biochemical derangements can occur preoperatively, postoperatively, or if a patient has a clinical condition, then how it can affect their condition. Then you should know a lot about endocrinology and reproductive medicine. Why it is so? Because if you don't understand the normal physiology of the female cycle, then it's going to be very hard for you to understand the basic concepts. You should know about a lot of things here. You should know the normal endocrinology and you should know about abnormal endocrinology. Both are equally important. You can be asked about several conditions. Then what is normal pregnancy? Anatomy, physiology, fetal physiology, placental physiology, parturition, how everything begins. What is the mechanism responsible for it? All of this stuff should be well known. Research, ethics, professionalism, patient safety, how you will apply the theoretical principles in the real world. All of these things are very, very important for you. So if I will talk about these different subjects, you should know that first of all, you should book your exam quite early. How much time you need to spend in the preparation? At least 6 months. So usually if you will spend more than this time, it's not going to be very helpful because you will keep revising the same material again and again, which is not going to be very productive. Be very clear. First of all, decide which books suit you and how much time you have. If you have 6 months, then you should go for essential revision guide. So revision notes, they are good, but the problem is that we have found several outdated things and some of the points are wrong. If you are in our course, then you can use our course because we are responsible for writing whatever we have written and we have collected it from multiple resources. So I mean to say is that you should be very clear that which books suit you, what you should do. You have done booking, this process is long, so you should start this correspondence with the college at least 1 year before actually you start taking you plan to take the exam. You should send your documents, they will be assessed. And as you know that in some exams, some part 1 exams, you can take like 6 attempts. If you applied for the exam but you couldn't take the exam for any reason, you couldn't travel, you, God forbid you are sick, in that case that will not be counted as an attempt. So you can just, but the fees will not be refunded, but you can take the exam again like that. So your entry in this exam where you couldn't take the exam will not be counted as an attempt. Tickets usually you will get like 4 weeks before the exam. Now you know that you will go to the center, PSN center. You have to check in well in advance, reach the station, reach the center at least 1.5 hours before the exam. They will check your identity, they will assign you computer, and now it is more important that you should apply early, because if you will be late, then you cannot take your exam. So right now, you know, they are testing everyone at the same time, but with passage of time, maybe this thing will change. So regarding the sources, I have told you that you can use any resource that you like, but it should be the latest one, because many things, especially in the genetics and in the pharmacology, in the microbiology, they change with time. So you should be very, very current on that. The latest evidence should be with you. Biostatistics are very important, and most of the candidates, they don't understand the basic concepts, because in the undergraduate years, when you're in the medical college, no one is testing you on this stuff. So now you have to enter your numbers, everything into the computer. Be very careful. Last year we got some students who were taking like this Saudi board part 1 exam, but they couldn't enter their details correctly. So as a result, you know, their exam was not registered, and this year they're taking the exam again. So you can understand that how much troublesome this can be. Regarding the format of the exam, you know that it is going to be a single best answer type of question, and you will have like 100 questions, but sometimes they can introduce more questions, but they will tell you about that this time we are going to get additional questions. So actually, these questions are developed by experts, and they follow special guidelines which are given by the college. So don't think that one question is just there because of any chance. This is not the case. These questions are thought well in advance, and there is an exam committee which reviews the questions, and then they will include those questions in the exam. So part 1 is usually the pass percentages, like you should acquire like 65% marks. Single best answer questions are asked. In the single best answer, you should know there will be a stem, then there will be a leading question, and then they will give you 5 question options. In some exams, they will give you 4 options. So the SBAs, the answer options, you should know that they are very similar to each other, and they have 4 options in alphabetical order. And you have to choose the option which is most relevant to the questions. And it requires good background knowledge and your critical thinking skills. So when you look at the options, 3 options, they will be distractors. 2 of the options, they will be very close to the correct answer, and 1 option can be totally incorrect. So at this point, if you are confused that how you should answer the question, read the stem carefully and then make a judgment, and then think that what is the best answer, and then fill in that place. Fill in that space, choose that stem, and write down that question number on the paper sheet. They will basically give you 2 sheets on which you can do any calculation, or you can write any important part. So you will just write down that I'm not happy with this question, so I should revise it. If we talk about the papers, that which questions, which subjects are included in paper 1 and which are included in paper 2. So still the distribution is going to be the same, like paper question format is going to be the same, and same questions will be there, but only for the way it has changed, like there will be computerized tests, computer-based testing, But like you are practicing with us, then you already know that we do questions in the same format. Like we are doing everything online, that and just you should not have any problem because our tests are all computer based. So paper one is going to cover anatomy, biochemistry, embryology, endocrinology, epidemiology, statistics, and genetics. Genetics are also very important for you. So specific question is a number of questions is usually asked from each discipline. So the variations they can be different. Like from genetics, you can get like up to 12 questions. In anatomy, in some exams, you will get 20 to 22 questions, and in some exams, you will get just 14 questions. In embryology, usually you can get 8% questions, like 16 questions can be on genetics. And then in embryology, you can get like 13 or 14% questions. Physiology is very important because from physiology, you can get from 12 to 20 questions. Endocrinology, here you can get like 15 to 17% questions. Then in pharmacology, again 20, 21, but in sometimes, you know, from pharmacology, just 10% questions will be there. But the point is that you have to cover each subject. Pathology is very important. And from pathology, you should know that they can ask you about the gross pathology, my histopathology, interpretations, markers, everything can be there, and they can ask you like 23, 24 questions. Biostatistics is very important, 9 to 10% questions. Microbiology, immunology, at least 10% questions. Biochemistry, usually 5 to 8% questions. Biophysics, 6 to 7 questions. Then from the data interpretation and the clinical management, they can ask you like, they can ask you somewhere like 20 to 22 questions. Then you should know that in the clinical questions, they can ask you many, many questions from them. That is the problem. So paper one, you already know that many questions can be from there. So, and the paper two is going to cover biophysics, clinical management, data interpretation, then immunology, microbiology, pathology, pharmacology. So all of these subjects are important. So you can see that 1/3 of your exam, it contains only this clinical management, data interpretation. You should be able to understand that what exactly they're asking you in the question, and then you should work on that and see that can you understand that what exactly they have asked you. That's very important. Okay, so go to the exam when you are fresh and you have really prepared very well. If you are not prepared, then don't take the exam prematurely because it can have very negative effects on you. It can be quite demoralizing that I took the exam and I didn't pass it, which is not a good thing. Okay, so you should stay positive, work hard, and then only then you should go for the exam. So we can divide part one into 4 basic functions, that why they are checking you. All core subjects are important. You should know that you should be able to understand the cell function. It involves good understanding of physiology, endocrinology, and biochemistry. Then you should be able to understand the human structure. So it means that you should have good knowledge of anatomy, embryology, and genetics. Third important part is understanding measurement and manipulation. So it means you should have good idea about biophysics, about epidemiology, statistics, data interpretation, and pharmacology. Then you have to understand the basics of disease, the basics of pathology. So in this area, you should know about immunology, microbiology, pathology, and clinical management. So last year, many things were changed, but basically you should know that in all modules, like all modules are there, you should know about clinical skills, about the teaching and research, core surgical procedures, then post-operative care, antenatal care basics, maternal medicine, management of labor, management of delivery, postpartum problem, gynecological problems, subfertility, sexual and reproductive health, early pregnancy care, gynecological oncology, urogynecology, and pelvic floor problems. So basically, you have to know the basic subjects here, not the clinical one, but it takes As you know that preparation is very important and preparation takes a long time. That is the point. So again, I will repeat the books for you. That essential revision guide is very good. Basic sciences for OB/GYN, the latest edition, go for it. Don't have the college has given many books on their list, but you don't have to cover all of them. Anatomy you can do from Snell's anatomy, or if you like some other resources, you can do that. And but the things should be up to date. And regarding the MCQs, many students ask about the MCQs, so don't rely on each and every resource. Like there are many good question banks are there, but you don't have to rely on all of them. And Hugh Sizer book is very good. Then Catherine is very good. So do at least two books. And then you need to do the college strategy questions. They are very good because they are written by those people who are writing your exam. So you can benefit from it. Okay. So these are at least they should be on your tips. The strategy questions, because even if you will get 10 or 20 questions, it is going to be very helpful. So you don't have to just loosely prepare for everything. Okay? Just stay focused. Don't go right and left and just do the needful. That is the point. Okay. Then you should know about the latest journals, what is happening. Then for the clinical purpose, you should know the green top guidelines, but not all of those guidelines, just a few of them. They are important for you to remember. Now I will tell you specifically that what you have to cover in each subject. So let's start with genetics. Genetics is one of the very most important subjects. You should know about, actually, all subjects are important because you are getting some information, and when you will answer that correctly, you will get some marks for it. Important for you to know about the structure of DNA, structure of RNA, and you should know about the nitrogenous bases and how they unite with each other. You should know about their structure. Steps of protein synthesis and the enzymes involved and the function of each enzyme. Then molecular biological techniques, lab techniques, we basically call them. Stages of cell cycle and what will happen in each stage of the cell cycle. These things are important because you will always get a question from here. That is the point, okay? You should know about chromosomal abnormalities, Down syndrome, Edward syndrome, Patau, Turner, Klinefelter syndrome. What is the underlying chromosomal abnormality and how you should fix it? Then chromosomes which will undergo Robertsonian translocation. You should know what is this Robertsonian translocation. Then types of structure abnormalities, chromosomal abnormalities, what are translocations, deletion, inversion. Then single best answers they can give you just an image and they will ask you what is the pathology here. You should know about the types of genetic disorders and their modes of inheritance, that which one is autosomal dominant, autosomal recessive, sex-linked dominant, sex-linked recessive, and what are different mechanisms, like what is anticipation, what is penetration. So you should know them because some like 3-4 questions are definitely going to be on the mode of inheritance, and in the notes on genetics you have seen there is a long list of each type of inherited disorder, so you should know about them. Cystic fibrosis is very common. Sickle cell disease, thalassemia, they are common, you should know about them. Screening tests for congenital and abnormalities, when they should be done. You should remember that if for which type of disorders you will do this chorionic villus sampling, and for which type of analysis you will do amniocentesis. What is nickel translucency? How do we do it? They can give you diagrams of different modes of inheritance, like I mentioned, autosomal dominant, recessive, X-linked, and you should be able to pick up that what is the mode of inheritance by looking at that pedigree. They can also show you pictures of karyotypes, like usually they will give you trisomy 21, 18, 13, Turner syndrome, Klinefelter syndrome. All of these things should be there and they should be on your fingertips. And you should, actually these are very easy marks. So if you will try well, you will be able to answer them. So anatomy is very important. You can cover it from any resource, like Snell's anatomy is very good, and our own notes are very good for it because they're very concise. You can go to PRS, many other resources are there. Basically, you should know about the general anatomy, which means that how the body is lying, what type of joints are there, what type of connective tissues are there, what are muscles made of, what is basement membrane. You should know about the histology, general layout of the structures. Then you should know about the surface anatomy of the trunk. You should know different vertebral levels, which is very important, and what structures lie against them. These are very important. And there can be some different points in the Oxford revision notes, and then if you will go to other books, then again you are going to find something different. But our notes are reliable, and if you like, you can go to Oxford revision notes because mostly they are like correct. Then muscles of the abdominal wall, you should know what makes up the anterior abdominal wall, what makes up posterior abdominal wall, how do these muscles of anterior abdominal wall lie, what is rectus sheath, what is the level of inguinal canal, what are the contents of inguinal canal, then femoral sheath and the femoral triangle, their boundaries, their contents, coverings of the spermatic cord. Then you should know about the coverings of the testes. Then you should also know about the anterior and the posterior um, triangles into the perineum. Pelvic structure should be very well on that. You should know that what are the different diameters, bones diameters, landmarks, muscles, fascia, ligaments, pelvic floor, what are making them. Levator ani is very important muscle. What is perineal body? And to know about the superficial and the deep perineal pouches. We're always getting the two questions from just one topic. You should know about ischiorectal fossa. What is the extent? What problems can occur? Know about the structure of rectum and anal canal, how this anal sphincter is formed, what are different layers, and what happens. Because understand that why it is important for you, because we should know what is the third degree perineal tear, fourth degree perineal tear, what muscles are lying there, how we are fixing them. Important to know about the blood supply of the whole GIT, even the heart, the cerebral circulation, then in the gut specifically, which is the artery of the foregut, which is the artery of the midgut and the hindgut. Blood supply of colon is very important. You should know the urogenital system in both genders very well. Know about all branches of aorta, their further divisions, at which level they are arising. These things are important for you. Then, of course, blood vessels of the anterior abdominal wall, because you should avoid damaging them or cutting them inadvertently. Then the blood vessels into the pelvis and the perineum, they are very important because your specialty is like that, that you will be doing surgeries on these areas. So important for you. Lymphatic drainage is very important. Know about the all genital structures. Why they are important? Because this infection will spread through them. Then you should know about the lymphatic drainage of internal and external genital organs, pelvic organs, anterior abdominal wall till the axillary level, and how the cancers they can spread from one half of the body to the other half, or from the lower part of the body to the upper part. Peripheral nerves in the pelvis, nerve injuries, pituitary gland, very important. Hypothalamic nuclei, where do they lie? Because now in the exam, since it is going to be CBT, so it is easier for them to put the pictures and ask you several questions. So my advice is that cover all the pictures which are given in your book. Any book you are picking up, just try to focus on all the pictures given in that. Don't leave anything. You should know about the location of different glands, their structure, and even their histology. Then pituitary gland, I told you that this is very important to you. You are going to get many questions from here. Know the structure of the fetal skull. I think we have covered that with all diameters, with all bones, anterior fontanelle, posterior one, and where they are meeting, what happens, which one is going to close first, which one is going to close later. All of these things are important for you. Then the structure of breast is very important. Um, what structures are making it up, and how we are going to see them, like lymphatic drainage, blood supply. All of these things are important. And actually, you should know that in anatomy, they can ask you about anything. So you have to be very particular about it. Know your anatomy very well. In embryology, the main topics to be covered are like you should know about the development of fetus, and you should know about the placenta. You should know very well about the membranes, how they are forming, how different structures are developing, and what type of questions they can ask you. General embryology is very important. Then you should know that in each week, what changes are taking place, at what stage the zygote is going to enter the womb, how it will affect everything. Know about the musculoskeletal system, stages of development of the lung, alveoli, when you will have this surfactant, what abnormalities can take place, how zygote is formed, how different layers are formed, what are the derivatives of different layers. We should know about development of all organs like CVS, fetal circulation, changes in the fetal circulation after birth. That is part of physiology, but you should know about the anatomical structures also, embryological development. GIT, what is normal herniation, what is physiological, what is abnormal, know the what is abnormal herniation, like in cases of gastroparesis, omphalocele, know the differences between them. Development of the urinary system and development of the reproductive system, as well as the abnormalities of the reproductive and the neurological system, these are very important. Nervous system, you should know about the time of development of the different structures, like when the neural plate will form, neural fold, neural tube, neural crest derivatives. Very important for you to know about neural tube development and their defects, and what can be the effect, which conditions are compatible with life and which are not compatible with life. Know about pharyngeal arches, pouches, and clefts, as well as their derivatives. Development of endocrinological system, especially thyroid gland, is very important. So basically, um, you can watch one video by this Aries on different stages of development, and they will show you that on which day of development a certain structure is formed and what type of abnormalities can take place. So that is very important source of information for you. Physiology is very logical, but since the students they ask many questions about physiology, what they should read, what they should leave. So basically, in the physiology, concept matters a lot. Your concept should be very clear because this is something which you cannot memorize. Know about the cell physiology, very important to maintain the internal environment of the cell. And if you don't know much about it, you should try to do it now because you need to read the concepts very carefully. Look at standard textbooks, at least for the pictures, like you can go to BRS, you can go to Guyton and pay attention to the pictures, what exactly they are doing. Read the tables carefully. Acid-base balance is very important. You should understand what is alkalosis, what is acidosis, how you will interpret the results, and these things are very important because survival is dependent upon the normal pH. What is the role of kidney? What is the role of respiratory system in maintaining the pH? What abnormalities can occur? What conditions will cause these abnormalities? And how you are going to read the results. You should know that how you can read the arterial blood gas analysis and how you should interpret that. Homeostasis, which is maintenance of the interior environment of the body, that's very important. You should know about different electrolytes, their normal levels, how the normal levels are maintained, and what can happen in the body if the levels are not normal. Calcium homeostasis is very important. How it is absorbed, which is the main site of reabsorption of calcium, in which conditions we lose a lot of calcium, what hormones have their role in maintaining the calcium homeostasis. Cardiovascular physiology is very important. Know about the cardiac cycle. know about the basics of Brand-Starling equation, how the hydrostatic and the oncotic pressure they are balanced in the body, and why these balances are important, how blood flow is redirected, and what are ECG findings, and what do they represent, and how the cardiovascular system and its interpretation it changes during pregnancy. What is the normal cardiac axis? What is cardiac output? And what is ejection fraction? What is the stroke volume? All of these things should be very clear. Okay, the phases of cardiac cycle, duration, and the changes during pregnancy they are very important. Respiratory system basically they are going to ask you about the lung volume, spirometry, and what are the changes during pregnancy, and oxygen hemoglobin dissociation curve, what factors are going to shift the curve to right and which factors are going to turn it to the left, and what is the meaning of turning it to the left or right. In the GIT, usually they will ask you some few questions. So basically you should focus on the changes during pregnancy and the changes in the nutritional requirement during pregnancy and what changes in the body can occur due to vitamin deficiency. Very important to understand the basic concepts of urinary system. We spent like 3 sessions on doing the urinary physiology. That's very important. You have to know the normal system and you have to know the abnormal system. How, what are urodynamics? What are the indications? What do we look at in the urodynamics? And then how do you identify that what sort of stress incontinence your patient has? So you should, to understand the pathology, you should know the normal physiology. What are normal urodynamic values? What changes occur during pregnancy? And how do we interpret them? And then again, in the urinary system, you should know about the nephrons, their structure, and they are very important. Which changes are normal, which in pregnancy, which changes are abnormal, and what do they tell us? So after that, you can understand that reproductive system should be very important, both in the male and the female. So you should know about the menarche, what is the physiology, then what are the follicles, how these follicles form, how the eggs are formed. You should know about the menstrual cycle, endometrial cycle, and hormonal changes during cycle and hormonal changes during pregnancy. This is very important. You should be able to understand. You should also know about the physiology in the menopause, what changes can occur and how they can affect the female. Male reproductive system, the organs, spermatogenesis, semen analysis, how their function is regulated. It doesn't end here. Physiology is very lengthy, very lengthy. You should know about the fetal and the placental tissue, which hormones are regulating them, and how these changes are maintained, what are the normal changes, what are abnormal changes. Then regarding other systems like the skeletal system, skin, metabolism, liver, here you don't have to do a lot, just remember the basic physiology, basic structures, and then you should be able to understand the changes during pregnancy. So the changes during pregnancy are always in the exam, so you should be very well, uh, you should be conversant with them. Endocrinology is very important, and basically you should know about the master control, which is the hypothalamus, what hormones are there, how do they control us, what is pituitary hormone, what is the role in maintaining the normal functioning in the body, then sex hormones, thyroid stimulating hormone, thyrotropin releasing hormone, adrenal hormones, pancreatic hormones, what is renin-angiotensin and aldosterone system, what is diabetes insipidus, and then hyperthyroidism, Addison's disease, Cushing syndrome, Cone syndrome, pheochromocytoma, prolactinoma, what changes take place at puberty, what are placental hormones, what endocrine changes occur during pregnancy, labor, puerperium, lactation, and what about the fetal endocrine system, when do they start working, and what type of hormones are produced, what from where do they get the precursors like that. All of these things are important for you. Pharmacology is very important subject. You should know about general physiology, general pharmacology, how the drugs are metabolized into the body, what are the pharmacokinetics, pharmacodynamics, how do they change in pregnancy. The more important subject is how do they change in pregnancy. You should know about antibiotics. Very important to know about HIV drugs like antiretroviral, highly active, antiretroviral therapy. Then malarial drugs. Then you should know about the antifungal drugs. How do they interact with each other? Then you should know about other antiprotozoal drugs like the antimalarials, antihelminthics. Then you should know about treatment of hypertension, cardiac problems. Anti-epileptic drugs are very, very important. You should know about their side effects, how do they interact, and why they are important, how their mechanisms change during pregnancy, how we can change, how we need to adjust the dose. These are very important, and then they're always asking you questions. And since the drugs they resemble each other a lot, so many confusions can take place. Then anticoagulants, what are their modes of actions, mechanism of actions, drug interactions, and contraindications. Very important for you to remember all of this information. Then drugs which are used for acidity in the body, antacids, antiemetics. If there is gastroesophageal reflux disease, what should be done? And then you should know about therapeutics, how they can abolish labor, what are their side effects, and what are the indications in preterm labor, in pre-prom, which drugs should be given. Then different types of drugs which are used for induction of labor, their indications, contraindications, doses, reactions, and very important you for you to identify that this drug is misoprostol. Like prostaglandins, they can be of many different types, and students usually they don't know about different preparations and their contraindications. It is very important to know that which one is misoprostol, which one is prostaglandin E2, which is dinoprost, what are the indications for use, what are the contraindications. Then is progesterone receptor modulators like mifepristone. Then selective estrogen receptor modulators like tamoxifen. What are their effects on the body? What is the raloxifene? What is the effect on the uterus? So you should remember these things very well. Different contraception, what drugs are used, what are their mechanism of actions. Then if you're paid, what are the indications, contraindications, medical eligibility criteria is very important. Then you should know about the drugs which are using for treating hyperprolactinemia, because you will always find certain questions on them. Which drugs can cause hyperprolactinemia and which drugs are used to treat this condition? Then what type of drugs do we use in cases of urinary incontinence and overactive bladder syndrome? What are the indications? What are the contraindications? And what are their modes of action? Because for you at this level, more important to know that what are their mechanism of action. Pathology is a major subject, so you're going to cover the general pathological aspects of disease, because you need to understand the illness. And regarding the systemic pathology, you should know about pathology of the male and female genital system. This is very vast because it covers all infections and a lot of stuff. So you should know about the basic principles like how the interior environment of the cell is maintained and when it will be disturbed, what sort of problems can occur. Inflammation. So you should know about the mediators of inflammation, what changes will take place, very important. Basically, you have to understand the subject because you cannot cram them. What is atrophy, hypertrophy, dysplasia, metaplasia, hyperplasia, cell injury, timings, what happens at how many hours, different types of mediators will come, necrosis, type of necrosis, and how do we differentiate them. Very important to know about phases of wound healing and by timeline, then development of this maintenance of the collagen, but its role in the wound healing. Know the neoplasia, cancer genes. You should know about the agents which are going to cause cancer, how do they do it, tumor markers, and hereditary syndromes, paraneoplastic syndromes. Know about the basic shock, and in shock, what type of blood transfusion you should give, what are the abnormalities in coagulation, Then pathology of the female genital tract, you can start from the very simple conditions to the very complex one, like simple mastitis, endometritis, STIs. How do they affect them, the health of non-pregnant women and the pregnant women? You are supposed to know about both of these conditions. Then in the male system, you should know about the common problems. Then medical disorders of pregnancy are very important for you. And you should know about general conditions like endometriosis, what is PCOS, especially incidences, what is GTD, gestational trophoblastic disease, ectopic pregnancy, cervical screening program, and especially the cervical screening program was changed like last year, so you should know about the new changes. That's very important for you. Among the medical disorders in pregnancy, you should know about hypertension, eclampsia, preeclampsia, stroke, what is HELLP syndrome, know about the diabetes mellitus during pregnancy, asthma, cardiac disease, acute fatty liver, and then you should know about skin eruptions during pregnancy and what are the underlying pathologies and how you should treat them. But basically, you have to remember that for how you will diagnose them and manage them. How you will differentiate HELLP syndrome from the acute fatty liver of pregnancy, what are their mortality rates, cholestasis, cardiomyopathy. Cardiac diseases are very important for you. Even the valvular heart disease, why it is important? Because you should know that what changes will take place and how you will diagnose them and what can be the impact on the health of your patient. Among biostatistics, you should know about the normal statistics. What is biostatistics? What is epidemiology? And in the biostats, you should know about inferential biostats and the descriptive. They are different types of studies. How do we mention them? You should know about different definitions. What are measures of morbidity, mortality? What is incidence? What is prevalence? What are their rates? Causes of maternal death? How many types are there? Which one is most common? Screening tests like sensitivity, specificity, accuracy, predictive values like negative and positive predictive values, and then likelihood ratios. All of these are screening tests. You should know that what are the screening criteria mentioned by the WHO and how we can use them in our clinical practice. You should know about the types of studies, what are different models, and how do we analyze the studies, like the relative risk, attributable risk, odds ratio, in which type of study, which type of test you will use, what is bias in the research, and how you can minimize that, and what is normal distribution of data in the population, what type of curve you are going to see. How do you measure the mean, median, mode? You will always get one question. What is right skewed data? What is the left skewed data? Measures of central tendency and dispersion, types of data, different types of scale is very important, and some of you find them very confusing. Then in the inferential study statistics, you should know about confidence interval, hypothesis testing, significance test, and the types of errors, type 1, type 2, how you can minimize them, and then other type of statistical tests and how do they correlate. Level of evidences, you are going to get one question from here. What is a meta-analysis? What is a systematic review? Know the difference between them, and how you can formulate a research question. Basically, what are you trying to achieve? So calculations, simple calculations, not the hard one. So you should know about the simple calculations also. Microbiology is very important. You should know about the general structure of bacteria, of protozoa, of virus. What are the structures in their walls, which are going to cause antigenic reactions, and what changes will take place in the body, how they are going to cause disease, the list of gram-positive and the gram-negative bacteria. It should be on your fingertips. Which are acid fast? What are the principles of staining? What exactly is grams staining? All of these things should be very clear. And this is very vast subject so, and then you should also know about the antibiotics. What is the mechanism of action, and what is and how do they become resistant to these drugs? Know about all types of streptococci, normal commensals, abnormal commensals, Then sexually transmitted infections, what is PID, how it is caused, what type of bacteria are going to produce disease through which toxins. So among the STIs, you should remember about gonorrhea, chlamydia, bacterial vaginosis, syphilis, different types of treponema, and you should know about the genital ulcers, different types of discharges, like what type of discharge and all. We're going to see in trichomoral infection, toxoplasma, and how you are going to identify them. Knowing about the genital ulcers is very important. Then among the viruses, you should know about the differences between the RNA and the DNA viruses. And the important viruses, the most important, I would say, for you are herpes family, because we know that HIV and this coronavirus, they're going to cause many problems. But how do they cause it? What are the other important structures? Herpes, and the most common, the herpes type 1, type 2, know the differences between them, rubella, parvovirus, human papilloma virus, HIV, and for HIV, go to the latest guidelines which are published in 2019. Know about different types of hepatitis, how do they spread disease, and then the skin infections like listeria, staph aureus, streptococcal. Know about the wound infection, actinomycosis, candidiasis, UTI is very important, purple pyrexius, and also sepsis during pregnancy and also in the postpartum period. So you can see that you have to do a lot of stuff here. And then in the immunology, you should understand the basic immunity of the body. How do you fight disease? How many different types of immunity are there? Different types of hypersensitivity reactions. You are going to get 2, 3 questions from here. Different types of vaccines. Vaccinations during pregnancy are very important. You already have a document on them that which organisms are going to cause a certain type of disorders. What are complement systems? What are the immune cells, especially the T cells? What are their functions? How many different types of T cells are there? How many different types of B cells are there? What are the differences between humoral and the cellular immunity? What are immunohistochemistry markers? How the immune system of the patient changes during pregnancy. Know about the common immunological disorders like SLE, multiple sclerosis, myasthenia gravis. All of these things are very important. So again, a lengthy topic. So the next topic, let's cover this biochemistry, that what are important topics in the biochemistry. Of course, you should know about the functional units of the subject, and you should know that what is DNA, what is heterochromatin, euchromatin, how do you identify them, which cells are, the which organelles are membrane bound, which are not bound. We discussed that in the previous lessons. So how many different types of cell receptors are there? Know about metabolism of glucose, like what is glycolysis, Krebs cycle, Cori cycle, and diagrams are very important to understand the concepts, and especially, you should know about the enzymes. And you should also know about the normal and the abnormal. Basically, you should know that all of these mechanisms, metabolism, they go hand in hand. So substrate from one cycle, it can be used, reused in another cycle. So you should know that how do they correlate with each other. So basically, you should have a good concept. You should be able to understand the blood glucose levels. How do we interpret them? What are the cutoffs? At what level you will say that this is a normal function, and when you will say that now it has become abnormal. Know about essential fatty acids, non-essential ones, saturated, unsaturated, what are ketone bodies, when are they produced, what are the benefits, how they can cause problems in the body, which are essential amino acids and which are non-essential amino acids, what is their importance, what is urea cycle, know about different types of hemoglobins, their percentage, and when their levels are normal or abnormal. You should know about the synthesis of different hormones into the adrenal glands. That is very important. You are going to cover it in both endocrinology and also in biochemistry. Know about the development of aldosterone, then cortisol, and then the sex hormones, which enzymes are present, what actions do they do, and what will happen if these enzymes are lacking. So then you should know about the metabolism of the prostaglandins, that the synthesis of prostaglandins, when you are going to get leukotrienes, and where you're going to get the prostaglandins, what is the difference in their composition, what is the method of their synthesis, the pathways, and what will happen if we will give different drugs, and how we can give them, how do they differ from each other. I mean the cyclooxygenase, lipoxygenase pathway, which drugs are going to affect them. Then you should know that what happens when we take food, how blood glucose level is maintained, and what happens if someone is starving. These changes are always asked. They will ask you indirectly, like K2 type question, where you will have to interpret the condition. So you should know that what happens, what type of changes, reactions occur if we are fasting, and what type of problems occur if we are not starving and we are taking excessive food or normal food, then how this will be converted into fatty tissue. So basically in biochemistry, your task is to understand the metabolism and synthesis of different structures and different mechanisms like that. Biophysics is very important. What are the principles of ultrasound? Then you should know about the units of radiation, what units are used to describe the dose of radiation in X-rays, in MRI. Then you should know that what effects can occur on the cell, dividing cells if there are radiation, and because they will cause ionization. What is background radiation? So units of measurement are very important. What are the radiation poisoning? What are the principles of radiotherapy? What are the advantages, indication, contraindications to MRI? What is laser? What are the principles of electrosurgery? Sometimes they will ask very simple concepts that what is the cutting um, bipolar and diathermy, and what is the coagulative diathermy. You should know the difference between them. Then what is a monopolar circuit? What is a bipolar circuit? I think we discussed all of these things before when we were talking about the surgery. Simple principles are there. Then we can ask you simple questions like this, that where should be the monitor, what should, like the biologics, I think we discussed that with the help of pictures, that how far should be the monitor in front of you, and what should be the angle of the arms of the surgeon, what should be the level of the table. So you should know about these things because these are very important, biologics also. And these are that how you can improve the skill, and what type of radiation you can use, what type of portable X-rays, MRIs. MRI cannot portable, X-rays can be portable. Principles of ultrasound, indications. Then you should know that what are the differences between the abdominal and the vaginal ultrasound, what microscope you are going to use, and the principles how you will discontaminate the probes. All of these things are like very, very basic things. Now, the basics, another difficult subject for you is going to be data interpretation and the clinical management, because the problem is that when you're doing the basics, as you know, that you have to cover so many different subjects, and this is additional, and now more and more questions on the applied, this clinical data and stuff. So you should be able to interpret many things. What is the intrapartum science? I think covered two guidelines. Nice guideline on intrapartum care for healthy women and their children. And then the second one is on nice guideline on intrapartum care of the women with different medical disorders. And these two are very lengthy, and you should be, if even if you have read them before, still it will take you like 8 or 10 hours to cover this guideline. But it's very important because it is giving you a lot of information. You should be able to understand different types of CTGs. You should be able to interpret them. And then what are the indications for fetal blood sampling? What are the indications for applying fetal scalp electrodes? What are contraindications? And when you should decide to deliver a certain baby if there are certain changes on them. Then regarding the data interpretation, when you're doing all clinical sciences, then your job is not to manage them. Your job as part one students, part one candidates, is to understand that what type of changes are taking place at the cellular level, at the systemic level, and how you can test these changes and how you can interpret the results. Basically, interpreting the understanding the results of in a different investigations is very important. And then in the line of previous investigation, how you can devise the next investigation. So, like in the data interpretation, they can give you very simple things. Like they can give you karyotyping results that interpret the results. So you can see, like I think I have also shown you that what will happen in cases of trisomy, if you remember when we were doing this screening stuff. How do we interpret the pedigrees, ECGs, ABG, how to read that, electrolyte imbalance, oxygen dissociation curve, like they will give you a graph and you will have to find the change. CTG, FPS results, FSC, then STAN analysis, then semen analysis, urodynamics, normal and abnormal sugar levels in pregnancy, RMI, you should know how to calculate that. I think we have done that many, many times. How you will read the results of, these tumor markers, hepatitis B, serology in virology. We have done that. And I think there were questions, several questions in the Q bank on interpreting the results. Then we have done it several times. Down syndrome, how do we assess the risk of a woman of getting this down, of having a baby with Down syndrome? Fetal biophysical profile, how do we interpret Apgar score? What is Bishop score? So all of these things are mentioned in the data interpretation. Now regarding clinical management, that is even more challenging because they can ask you about so many different subjects. So basically, as I've shown you before, you have to do some topics from the talk, the journal, and most of the topics from the guidelines. But you don't have to do all guidelines, and there is a specific way of reading them. Like there are some topics which you have to do at all costs. Like abnormal uterine bleeding, how do you manage them? What investigations you will do? What drugs you will do? What are the modes of actions of different drugs? HIV, diabetes, PIT, STIs, immunizations, bleeding in all parts of pregnancy, like in miscarriage, in ectopic, in antepartum hemorrhage, postpartum hemorrhage, then intrapartum hemorrhage. All of these things, shock. How do we identify that? How do we measure them? How do we manage them? What are obstetric emergencies? Very important. You're always getting questions on them, because without that you cannot move forward. Like the tears, shoulder dystocia, undiagnosed bleach, then card prolapse, different stages of normal and abnormal labor, hypertensive disorders, very important. We have done that with NICE guideline. Diabetes, we have done how to maintain the euglycemic state, then tumor markers, germ cell tumors, management of CIN. Now you have to refer to the new guideline. Then degree of perineal tears, how do we identify them? How do we manage them? Then what are the causes of infertility? How do we choose the right diagnostic test? How do we manage them? Uterovaginal prolapse is very important. You should know about different techniques of ART, assisted reproductive technology, endocrinological disorders, cancers like hereditary syndrome. You should know about them. So lots and lots of topics, but what is the key? The key is that you should be familiar with the part one syllabus. You should be familiar with the exam structure. You should be able to revise the key areas, and your challenge is that like 2 weeks before exam, you should be able to revise all of your stuff, and you should do it at least 2 times. 2 times, and the third revision should be just before the exam. So, and then you should take the exam only when you think that you are ready to take the exam. If you are not fully prepared, don't take the exam, because you have a limited number of attempts. And after that, in case of failing, it can be like very demoralizing. So you have to work hard just to know about the structure of the exam, what type of questions they are going to ask you, how you should answer them, and how much time you should spend on each subject, how you should be able to answer the questions under a lot of stress. And here, if you need any help, you can always come to us. You are most welcome to join our courses, because they are very practical, and all of our team, they have these qualifications, and they have work experience in different areas in different countries. So we understand that what type of problems you can have and how we can fix them. So different courses are available. If you want to ask about them, then you can ask like you can contact us. Here are you can find us on the social media. So here you can find this information that how you should contact us, and we can help you with different courses. Like there are group courses and then there are individual courses also. We have many students who are coming just for one-to-one sessions, or if you want to join us only for the crash courses, for the short course, you still have time. So you can ask the questions if you have. I'll be very happy to answer your questions. And then me and my team, we wish you all the best. And if you have any questions, please feel free to ask me. We have got many groups, so you can just post on them in the various groups, and we are going to answer your questions. And I wish you all the best. And you need any help, you can approach us. You can come for the paid courses, or you can just subscribe this Aries channel, because you can find a lot of stuff. You can find a lot of free stuff over there, and you can follow us on Facebook, on the WhatsApp, on Telegram, on Twitter, on Instagram, and then you can email us also. And here is the YouTube channel also. If you subscribe this channel, you are going to get a lot of free material, because now, especially because of COVID virus, since it is very hard, many people they have been like laid off the job. So we are providing a lot of free material, but you have to subscribe to get the notifications whenever we are loading some new picture. So with that, I will conclude it. And still, if there is something which you have not understood completely and you want to ask me about that, you are most welcome to ask me. Thank you very much for attending this session. And again, good luck and bye-bye.